السلام عليكم ورحمة الله. موضوعنا اليوم عن Cranial Cavity. Here the scalp. The scalp consists of bones, multiple bones. Here is the cranial cavity. The cranial cavity contains the brain stem, and the arterial supply and venous drainage, and all sorts of the cranial nerves. The cranial cavity has its roof and a floor. Now we will talk about the roof. The roof consists of multiple bones. Here is the frontal bone. Here are two parietal bones. Here is the occipital bone. There is sutures. The sutures between the frontal bone and the two parietal bones is the coronal suture. The suture between the two parietal bones is the sagittal suture. The suture between the one parietal bone and the occipital bone is the lambdoid suture. Okay, lambdoid suture. Here we have the area of junction between the coronal and the sagittal sutures called the prigmen. Here is the prigmen. Okay, now here the area of junction between the sagittal sutures and the lambdoid suture is the lambda. In the frontal bone we have this area which is the frontal crest. The frontal crest give attachment for falx cerebri. Falx cerebri which partially separate the two cerebral hemispheres. Next to from the anterior to posterior, this is the groove for superior sagittal sinus. On the sides of this groove are some pits, which called granular fivulae, which are pits for arachnoid granulations that reabsorb the cerebrospinal fluid. We have also the markings and grooves for blood supply of the brain. Here is the floor of the cranial cavity. The floor of the cranial cavity has three fossae: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. The anterior cranial fossa consists of three bones: frontal bone, ethmoid bone, and the sphenoid bone. Here is the frontal bone which overlies the orbits and the nasal cavity. And here sits the frontal lobes of the brain. Here is the frontal crest for attachment for falx cerebri. Here is foramen cecum, which has the opening which transmits the emissary veins from the nasal cavity to the brain. Here is the crista galli. It's also for attachment for falx cerebri. Here on the lateral of the crista galli is the cribriform plate, which transmits fibers of the olfactory nerves to the olfactory bulb. Here is the sphenoid bone. Two parts of the sphenoid bone are in the anterior cranial fossa, which are the body of the sphenoid bone and the lesser wing of the sphenoid bone. The area that borders between the anterior cranial fossa and the middle cranial fossa is the prechiasmatic sulcus. Of the lesser wings of the sphenoid, there is two processes which named anterior clinoid processes. Here, just anterior to the anterior clinoid fossa, anterior clinoid processes are the optic canal, which transmit the optic nerve and the ophthalmic artery. Next, and posterior to the anterior cranial fossa is the middle cranial fossa. The middle cranial fossa, here the temporal lobes of the brain are sit here. Also, the middle cranial fossa consists of the body of two bones, the sphenoid and the temporal. Here is in the center, and then the midline is the body of the sphenoid, and here is the greater wing of the sphenoid, and this here is the temporal bone. In the center we have this sella torsica. This is the sella torsica. The anterior part of the sella torsica and the anterior wall is the tuberculum silli, and here is the dorsum silli. In the center there is hypophyseal fossa. Here are two processes. These are, as just mentioned, the anterior clinoid processes. Here are the middle clinoid processes from the tuberculum silli, and from the dorsum silli there are two posterior clinoid processes. The importance of these processes are for attachment for the tentorium cerebelli that separate the main part of the cerebral hemisphere from the cerebellum. In the middle cranial fossa are several openings. Here is the superior orbital fissure. In the superior orbital fissure, there are many structures that are transmitted between the middle cranial fossa and the orbits, which are the third cranial nerve, which is the oculomotor nerve, and the trochlear nerve, and the abducent nerve. Also, there is the ophthalmic veins and also the ophthalmic nerve, which is a first branch of the trigeminal nerve. Here is next to the superior sagittal sign, superior orbital fissure, is the foramen rotundum. Foramen rotundum transmits the second branch of the trigeminal nerve, which is the maxillary nerve. Next to it is the foramen oval. Foramen oval transmits several structures between the middle cranial fossa and the pterygopalatine fossa, which are the third branch of the trigeminal nerve, which is the mandibular nerve, and also the lesser petrosal nerve, and also sometimes the accessory middle meningeal artery. Next and lateral to it is the foramen spinosum. Foramen spinosum transmits the middle meningeal artery and the associated veins. Posterior medial to the foramen oval is the carotid canal and the foramen lacerum. Here, the foramen lacerum is in life closed by a cartilaginous plug, and also there is no structure pass through it. Here is the trigeminal impression. Lateral to the trigeminal impression, there is the groove and hiatus for greater petrosal nerve and the groove and hiatus for lesser petrosal nerve. Here, also in the middle cranial fossa, there is an elevation which is for arcuate eminence, for the impression for the inner ear, which is the anterior semi-lunar canals. Next and lateral to it, there is a depression here for the tegmen tympani that overlies the canal for the middle. The posterior cranial fossa. The posterior cranial fossa, the anterior boundary of the posterior cranial fossa is the elevated and the superior part of the petrous bone of the petrous part of the temporal bone, while the posterior boundary is the squamous part of the occipital bone to the level of the transverse sinus. There is a large opening which is the foramen magnum. The foramen magnum transmits the spinal cord, the vertebral and its meninges, and also the vertebral arteries, and also the roots for the accessory cranial nerve, which is the cranial nerve 11. Here is the jugular foramen. Jugular foramen transmits the internal jugular vein, the sigmoid the sigmoid sinus, and also the glossopharyngeal nerve, the vagus nerve, and the accessory cranial nerve. Here, lateral to it is the internal acoustic meatus that transmit the facial nerve and the vestibulocochlear nerve. Here is the clavus bone that consists of the sphenoid bone and the basilar part of the occipital bone. Here is the groove for the inferior petrosal sinus, and here there is a groove for sigmoid sinus. It is obvious here, groove for sigmoid sinus. Here is the internal occipital crest, that separates the cerebellar hemispheres. Here is the internal occipital protuberance. Also on these sides are the groove for transverse sinus. Here it is obvious the hypoglossal canal that transmits the hypoglossal nerve. Here today, at the end of this video, we have read and done the floor and the roof for cranial cavity.